you just tend to kind of go downhill from there. Schizophrenic patients tend to have increased blood concentrations of inflammatory cytokines. We've also seen several randomized clinical trials of the NSAIDs, celecoxib, and aspirin specifically, where they've been used as adjunct treatments to antipsychotics. Also, adjunctive treatment with the antioxidant N-acetylcysteine, or NAC, as you'll hear it in the ER, or fish oil significantly reduce psychopathology in schizophrenic patients. So just some of the cytokines that we tend to see related to schizophrenia. Interleukin-1 beta, interleukin-6, transforming growth factor beta tend to be higher in patients than in controls during an exacerbation of symptoms, but we don't really see a difference during periods of clinical stability. Interleukin-12, interferon gamma, and tumor necrosis factor alpha, or TNF-alpha, these appear to be our trait markers. They're higher in the first episode patients than in controls, but we also see them higher in patients with chronic illness during both periods of symptomatic worsening or the exacerbations and clinical stability than we see it in controls. So a little bit more about the cytokines. Studies suggest that the Th1 cytokines, such as interleukin-2 and interleukin-12, tend to be decreased in schizophrenia. C-reactive protein, we've noticed this appears to be kind of a state marker in these patients. We also have kind of noticed that maternal serum concentrations of the cytokines IL-8 and TNF-alpha during pregnancy were associated with an increased risk of schizophrenia in their offspring. That comes into play here in a little bit. Bottom line is inflammatory molecules may predict subsequent relapse. That's one of the things we hope to do with this. So some of the abnormal levels of inflammatory parameters in the central nervous system in schizophrenia. Sometimes we can see CSF cytokines and leukocyte levels. We can also see an increase in microglia and lymphocytes. We can also note CSF and CNS oxidative stress and anti-NMDA receptor autoantibodies. Okay, so just a little bit about BDNF, brain-derived neurotrophic factor. This is a member of the neurotrophic family, surprise. Promotes the development, regeneration, and sustaining and maintenance of neuron function in the central nervous system. It modulates neurotransmitter synthesis, metabolism, and neuronal activity. It's in part responsible for the development of dopaminergic-related systems and the mesolimbic dopamine systems. Bottom line is, this does a lot when it comes to the CNS. Decreased serum BDNF levels have been reported in neuroleptic-free patients with schizophrenia relative to healthy controls. This is also noted in chronic patients with schizophrenia that happen to be on antipsychotics. So, question would be, why would people with schizophrenia have increased inflammation? So we could see some prenatal risk factors: preterm labor, preeclampsia, infections. Specifically, one article mentioned influenza and rubella in the mothers that could tend to that can show up with they can have schizophrenic patients or children later. We also see neonatal birth asphyxia, maternal gestational diabetes, stress, and even depression. So we also see abnormalities in schizophrenia that are associated with inflammation, increased autoantibodies, oxidative stress, CRP, and circulating lymphocytes. Kind of a lot about what we've been showing thus far. So a little bit about peripheral inflammation and brain function. So we see inflammation related to like Alzheimer's disease. We see cognitive impairment at that point. We've also seen that rheumatoid arthritis is a risk factor for dementia. Depression is associated with increased inflammation. Cytokines, they directly modulate dopaminergic neurotransmission and indirectly modulate glutamatergic neurotransmission. Both of these play an important role in schizophrenia. Inflammation may actually disrupt the blood-brain barrier. This is how a typically immunoprivileged area like the brain can get this inflammation in there and cause these problems. We could see an abnormal trafficking of cells and inflammatory molecules between the blood and the brain. Okay, so method. We took serum samples from 92 chronically medicated patients with schizophrenia and 60 healthy controls. What we were looking for was serum BDNF, tumor necrosis factor alpha, and interleukins 2, 6, and 8. We determined schizophrenic patients using the PANSS model, the positive and negative symptom scale, specifically looking at the cognitive and depressive factors derived from this 5-factor model. So these are the demographics of our study. How we try to control for a lot of these potential confounders. You can see from our p-value on the far left there what we were trying to make sure that these were as statistically insignificant as we could. Okay, so our results. Compared to our control group, the schizophrenic patient samples have significantly decreased levels of BDNF and TNF-alpha, but significantly increased levels of IL-2, 6, and 8. In the patients benign the controls, we observed a significant negative correlation between BDNF and interleukin-2 and between BDNF and interleukin-8. Furthermore, another negative correlation we saw was when you have the BDNF and IL-8, this tended to be associated with the PANSS depressive factor. But when you had the negative correlation between BDNF and IL-2, this was associated with the PANSS cognitive factor. So there could be even some different play into how the symptoms of schizophrenia can manifest in that regard. So this is the graph that's showing the way our data fell. You see some outliers there, but interleukin 2 level versus BDNF is there on top, and interleukin 8 versus BDNF is there on the bottom. So just a little bit further discussion. We kind of talked about this before. This is a recapitulation of all the evidence regarding interleukin-1 beta and 6 and transforming growth factor beta, how they're higher during those symptoms of exacerbation, and also the trait markers that we discussed in it and how that they are higher in first episode patients. Okay? And again, BDNF levels have been reported to be decreased in patients, neuroleptic-free patients, relative to healthy controls. So our study specifically compared to the control group, the schizophrenic patient samples have significantly decreased levels of BDNF and tumor necrosis factor alpha, but significantly increased levels of IL-2, 6, and 8. So kind of a little bit of further discussion on this. Antipsychotics. By themselves, they tend to show increased weight gain and diabetes. These are both associated with inflammation. Some of the confounding factors that I mentioned earlier: body mass index, age, gender, smoking, alcohol and illicit drug use. We did work very hard to control for these, but these are potential confounders. We also have seen medications for rheumatoid arthritis. They've been studied in depression. This also is looking towards a way that we can help we can link inflammation to psychopathology. As we all know, inflammatory molecules, they have very, very complex interactions among themselves and every other system. So this is a very, very exciting field with a lot of potential for some really, really amazing finds in the future. So our conclusion: the decreased level of brain-derived neurotrophic factor and change of immunocytokines level may be implicated in the pathophysiology of chronic schizophrenia. Moreover, these immunocytokines may interact with brain-derived neurotrophic factor in schizophrenia, which may contribute to the clinical symptoms and cognitive impairment in schizophrenia. So these are our references. Okay. All right.
Great. Questions?